used to be a professional handball player, injured myself, had a bad meniscal surgery that gave me osteoarthritis. Long story short, I fixed my knee by injecting a lot of platelets.
Dr. Torbjörn Ögéus, a Stockholm-based regenerative medicine clinician and researcher, after a career-ending handball injury, he rebuilt his own knee and went deep into platelets, stem cells, and exosomes.
Why do you think a stem cells right now is such a trendy, such a noisy word?
Social media just makes everything so much faster.
Why is it still very controversial in some countries?
It doesn't have to be. This is where it gets controversial.
When you look at regenerative medicine as heading, what gets you most excited?
I think the positive side effects.
Stem cells you can derive from your own blood. Exosomes you can also derive from your own blood, but you will not get trillions.
I believe I can definitely get the trillions. The question just...
On today's episode, we were joined by Dr. Torbjörn Ögéus. In it, we discussed what stem cells really are, what forms they come, are they dangerous, and why they were considered dangerous in the past, in what forms you should actually inject them in IV form, where you should inject them for the best benefit and how, should you combine them with exosomes, and the future of the regenerative medicine market.
So stem cells is something which I've been very interested in over the past year or so. It's all the hype. Lots of people are talking about it, but there's a lot of things that you need to understand about who you should get the treatment from and what treatment you should get, because not all of it is going to be suitable for you. And then lots of people are actually giving treatments such as the IV drips, which aren't actually going to be as effective as you've been told.
Dr. Toby, as most of your patients and friends call you, I had the pleasure to visit you in Stockholm at your clinic, SLS, and actually get treatment.
Yep.
With several days. And the reason why I flew out to Sweden was because I was told in the space of stem cells and exosomes, there's a lot of people and a lot of offerings, but almost nobody actually takes the time to do the proper research, including on human trials. So if you can talk a little bit shortly first about your background, how you got into the space, and then talk about the market today in general.
Yeah, sure. Well, my background, I used to be a professional handball player, injured myself, had a bad meniscal surgery that gave me osteoarthritis. So osteoarthritis is basically when the cartilage is damaged and a lot. So my career was over and I tried to fix my knee. Long story short, I fixed my knee by injecting a lot of platelets that I centrifuged on my own.
Yeah, how did you do that?
Yeah, so I'll tell you, it's kind of a funny story actually. I was a student, so all the money that I had from my handball career, I put in the down payment of an apartment. So I didn't have the money to buy a centrifuge because they're kind of expensive, the good ones. So I built one from a table fan. So I drilled holes in the blades and I was spinning blood. So my dad is a medical doctor and I asked him, like, if someone was to shoot something into someone's knee, how would one go about? And so eventually I did it. And it was scary as, but it worked. And I did it 3 times per week for 6 months. So 6 months later I could run and jump. And that was from a space where I couldn't even walk without a crutch or a cane. So I really regrew cartilage. It was very impractical, obviously. 100 injections in a patient, you can't do that. But I realized that I was onto something. So the idea from the beginning was to get back to handball. But when I realized that I could heal cartilage, I realized, okay, I'm going to keep studying. Yeah. So today I have 4 degrees basically, and I'm finishing my PhD in regenerative medicine. So my centrifuges today are a bit better. So, what did you ask me? That was my background, how I got into the space.
So, first of all, do it yourself to the next level. If I would come to my dad and say, how can I recreate the centrifuge and can I inject this thing in myself? My dad would be like, what are you doing?
My dad would be like, no.
No, you cannot. So, can you please explain what centrifugation is and why it's necessary and what were you actually injecting in yourself? Because for the listeners to follow a little bit on.
No, that was...
this was because the doctors messed up as well when they were performing the surgery.
So basically they did a microfracture, which is it's a method that isn't really used anymore because it was very unsuccesssul, let's say. So when they were inside, I wasn't supposed to be under, but they put me under. So I was sleeping basically, and they while they were inside, they were supposed to fix my meniscus. They found a small tear in the cartilage, so they thought, we're gonna poke up there and get it to bleeding and start the healing process, which is a good way to start it. The problem is that the healing will not go on. So it will not be cartilage, it will become something that is more fibrous, which is horrible. So the more you use it, the more it turns into bone. Then you just have bone on bone, and that, it's super painful. So, and the rehabilitation they gave me was completely wrong. So I met like 5 orthopedics, the best ones in Scandinavia and in Germany. And they were all saying like, the surgery was good, you're just not doing the rehab. And I was a professional, I was doing my rehab. But it was just got worse and worse and worse. And eventually I couldn't walk. And then the 5th guy I told, like, now we're going in the knee because we need to know what's happened. And then they realized, you have no cartilage left on the whole of the inside. And it's pretty bad up in the trochlea. So, I was motivated. It just didn't come overnight. I mean, it's a process of like a year where I was reading studies. So all of the students in med school when I was studying, they were afraid of like the tests and all of this. I aced the test because I already read all of that. I was reading so many studies, I think 3,000 studies, in order to get to the point where like, platelets. So platelets are part of the blood, which are very essential for healing. So everything basically heals with blood. If you have an injury, let's say to a muscle where you have a lot of blood flow, obviously there will be a bleeding. The blood will coagulate. That's when the healing starts. And what happens is that the platelets in the blood, they will shoot out growth factors. So growth factors will activate building material. This building material is called stem cells. So the stem cells in turn will shoot out small particle signals that are called exosomes. The exosomes will recruit cells that will tell them what to do and duplicate and stuff like that. Then you will have an inflammation. This inflammation that comes after the bleeding is fantastic because it causes cells to divide and multiply. So we'll have more of the building material and you will be healed. But if you have an injury in a place in the body where there is not so much blood supply or then there will be no healing. So we need the platelets. We need that to ignite, to start the healing. So the centrifuge is basically a device that spins, test tubes or anything very, very fast. So when it comes out, depending on the speed, the parts of the blood will be separated. So it's segmented and you can just suck up which part you will with the syringe. And platelets are basically the most important parts, but then you have some other like fibrin and albumin.
So basically it gets you the stuff the resources that you need, the platelets that you need. That's what distribution you need. So then you inject that to the places that the blood flow is not there enough to start rebuilding. So what you did back then was you got the platelets in a large amount and injected them regularly in the same place over and over again to tell the body, hey, this is where you need to build and this is where you need to fix.
Exactly that.
Okay. This is what, 10 years ago? More?
More. So I'm 46 now. That was then when I was 30. So 16 years.
16 years ago. Okay, perfect. So now we're at this point. So 16 years later, everybody in our surrounding is talking about, besides peptides, is talking about stem cells. Why do you think a stem cells right now is such a trendy, such a noisy word? Why currently?
I mean, I think the science has reached up. It's been trendy. I mean, when I started reading about stem cells, they were saying like, in 20 years, there's going to be something where we just found this and that might be. Now we actually see the results. So we have fantastic effects that are coming out. Diabetes, I heard for kids, you can actually reverse it if it's early enough. And of course, osteoarthritis that I do my research in. It's we actually have some evidence coming. So this is one thing. And then I think the whole world, social media is just makes everything so much faster. So, and of course, it's everybody wants, regeneration that is without chemical drugs. It's biological, treatment that is actually could be very expensive, but it's very good. Let's say.
Why is it still very controversial in some countries? Is it banned in some countries?
It doesn't have to be. But I mean, let's dive into what stem cells actually are.
Okay.
So stem cells are basically cells that can divide almost, inevitably how many times they want. So the first type of stem cell is when the sperm and the egg meets. That's the embryonic stem cell that can become everything because it builds a whole human being in the womb. But these cells, the embryonic cells, they can actually also turn into cancer. So we can't use them clinically. They're very good for research, but you don't want to risk cancer.
Mm-hmm.
So that's the first type. They're called omnipotent. They can become everything. They can heal the whole body. Then you have the normal cells, let's say, that the most of the people use when we do stem cell treatments is called mesenchymal. They're not omnipotent. They cannot become everything. They become a lot of things. So they can usually be found in bone marrow or fat or umbilical cord fluid, or blood actually. So they can become skin, bone, tendon, cartilage, but not nerves, and they cannot repair the brain and stuff like that. So they're good, but they're not optimal.
Yeah.
So in recent years, let's say, you have some types that are pluripotent. Pluripotent is like the Holy Grail, because that means that they have the capacity to basically heal any cell type, but they cannot become cancer. So these ones are the ones you want, but it's been so expensive to get them out, because they're usually subpopulations. Like if you have stem cells from someone's fat, a small portion of that is going to be these pluripotent cells. So you have to they have to go through processes in the lab that are very expensive. So usually these treatments are extremely expensive.
Mm-hmm.
So to source them, you need a lot from the same person or a lot of people?
This is where it gets controversial. So in most of the world, you can only use your own stem cells. So in the EU, that's the rule to 99% of the countries. If it's donated, then it has to be very carefully sourced, let's say. In some countries, I mean, it's okay to use donated stem cells.
Like Panama,
Mexico, Thailand, stuff like that. And then you have, the laws just changed this year in Florida, Nevada,
Lithuania, Tokyo.
Yeah. So you have some places where you can actually use them. And in the beginning, everybody was afraid that you would get a reaction, like you have someone's DNA. What happens when I introduce that in my body? Actually, nothing happens when you do it like you're supposed to do it, like inside of a joint or so. There is actually kind of funny. If the cells that we can use in Sweden and have been using for years is from abdominal fat from the same person. So we do liposuction, get them out. If you do that twice, there is actually a 50% chance that will be a complete,
rejection.
Rejection is actually the word I'm looking for, yeah. So we can only do that once. But with the donated cells, you can do it multiple times. But there are developments, and I guess that's why I'm here talking about the things that I found.
Absolutely. Again, so just from the audience perspective, the omnipotent one are the ones that are scary because they become turned into cancer. Yeah. So this is the ones that the reason why people were pushing backwards was regards of that. The pluripotent ones are very, very useful because they don't couldn't become cancer, but it's hard and expensive to source.
Yeah.
And if you would source it historically from yourself, it would be limited to it. And if you source it from others, it might be illegal.
Yeah.
And then comes the reason why you and I met, and the reason why when you and I met, you told me, hey, great to meet you, but I'm on my way to Stanford to present one of my findings that I believe has one of the most groundbreaking findings in recent time in stem cells.
Yeah.
And can you please share with the audience now what you found and why we think this is the most groundbreaking finding in this sector in a long, long time, if not ever?
Sure. So I have to give you a little bit more background. So normal stem cells, the ones we talked about, the ones from umbilical cord blood or from your bone marrow or fat, they're kind of big for being cells. They're somewhere between 10 and 25 microns. That means that there are certain things they're good at. For instance, if you inject them into a knee with osteoarthritis, they're good. They can definitely help you heal the cartilage. But intravenously, which is a route that a lot of people are doing. I mean, we can just do a quick Google and we'll find 20 clinics where you can go and do IVs with stem cells. So the blood circulation takes about 12, 15 seconds, one lap around the body. The first bottleneck that the blood meets is in the lungs. So the lungs vessels, they're big, and then they're so small that they basically are 6-7 microns in diameter.
So half the size.
So half the size of the cells. That means that all of the ones that are 20 or 15 microns, they will be stuck in the lungs.
So if I see an IV drip come do an IV drip of stem cells, best case scenario, they're healing my lungs. Worst case scenario, get stuck in my lungs and overdose me.
Yes. So
every single time you and I see a clinic and or an ad for that, that's what we're actually buying.
Yeah, so they will be clogged in your lungs for sure. They've seen that. I mean, there are dozens of studies that says this. You know, this is what happens. We know this. This is purely mechanical. It's physiology. It's super simple. There could be like this. You have an inflammation that starts because of the clogging that actually starts other processes in the body which are kind of positive, but it's you're not getting what you're supposed to. They're selling it like, hey, do this IV and you will heal all of your organs. You will be fantastic. It's not what
I've seen a lot of that.
Yeah. So that is, that's bad. I mean, I'll tell you the story of how I found the cells because it's kind of funny as well. I read a study from a group of Greek scientists. I think it was this spring or something like that, almost a year ago. Sounded too good to be true. They said that they have found one of the pluripotent cells in normal blood. So, adult blood.
In your own blood, for example.
In your own blood, yeah, exactly. So that makes it legally very interesting.
Everyone in the world, yeah.
Exactly. So they said, basically, that from 3 tubes of blood, you will have 90 million stem cells that are pluripotent, and they're 5 microns in size. So they would actually pass in the system as well. So that sounded just too good to be true.
Quick one here, because you said 90 million. Mike and I don't understand. Is 90 a lot? Is it how much do you need?
Yeah, so normally, if you're going to Panama, if you're going to any of these countries, or even here for that matter, basically we always aim for 100 million stem cells. That's
starting
like what you
point.
pay for. Yeah, that's like the gold standard. If you want to treat an E, it's going to be with 100 million cells.
And this is in one injection or?
Yeah. What's this guy's name that doesn't want to die? Brian Johnson. So he had, I think, 300 or 400 million injected into his knees. Swedish stem cells from doctors that donated them, or med students probably. Which is fun, is good.
But is stem cells the more the better? Is there too much stem cells?
I think the highest number I've ever heard of is 2 billion in one shooting. I'm not sure if it's...
It's that person after that.
There's probably an upper limit. I don't think it's dangerous. Probably it's just not going to be more effective. But, I mean, we're going to get back to that because there are many things happening in this space. Yeah. So I had to test their protocol, because it sounded too good to be true, as I said. So I bought a new microscope. I bought a cell counter so I could do their protocol. It was super simple. It's just a couple of spins with the centrifuge again and some filter. And they lied, or they exaggerated, because I got, after 200 tests, I had like 20 millions, not 90, which is still a good number. We just need to draw more blood. So during this phase, let's say April, May or something like that, I was doing a lot of tests. I draw my blood like 10 times per day, and all of my colleagues and some, everyone I met basically, can I have your blood? It was a fun time. It probably looked like, I picked up a drug habit or something. But it was good fun. And I saw variations. But the coolest thing is that I found out that, I had the aura ring. So I saw that when I was stressed, there was another cell that popped up all the time. And that was even smaller. There was 1 microns, not 5.
Which is so 5 times smaller in size, so it doesn't get stuck in the lung.
Yeah, and both of them will actually not be stuck.
Yeah.
So, but this one is even smaller, so it's super small.
What do you mean it popped up when you were stressed?
Yeah, I'm analyzing the blood.
Okay.
Using this really cool device, cell counter. So basically, you will see the size, you will see if it has a nucleus, if it's viable, or if it's dying, or stuff like that.
So if you were drawing your own blood, you would say, I'm feeling quite stressed at this point in time. So
yes, I mean that's pretty much what I saw, because I was looking just for the 5 micron cells.
Yeah.
This is important now from the audience perspective, because this was my biggest breakthrough when I was trying to understand this. If you draw blood and he can see the amount of stem cells inside of your blood, and he can tell you, is it good to have a lot of them or a low amount of them? Your natural reaction is?
You would assume more.
More, right?
Yeah.
But it's actually the opposite.
Yeah.
Because a stem cell is a building block that if something stressful happens to your body, it creates building blocks to fix it. So actually, if you ran a marathon and you draw blood, you have a lot of stem cells because you need to fix it. But if you had been chilling on the beach for a week, you have a low amount. So when he's stressed, he sees 4 stem cells. So for what's mind-blowing to me, because I was always thought, the more the better.
Yeah.
Well, actually, no. If you have a lot of stem cells in your body,
for the treatment, it's good that it's a big amount. But yeah, this is exactly the point. So the cells that I found, I mean, let's skip to the the point. They're called very small embryonic-like stem cell, these cells. They are basically as old as you. So when we're an embryo, they will be basically advanced 1 step and then halted. The body stores them in the bone marrow and then circulating in the blood, but they're inactive. They're activated by stress, like hypoxia or hypothermia. So if you have a heart attack, you will definitely see a lot of these cells activated.
Because they're stronger, because they're more potent?
Yeah, they are more potent for sure. I mean, I found out that they survive any very harsh environment. But it's just a way. I mean, I guess it's just a backup system for the body. If you're under some big stress or if you injure yourself, you need healing, and that they are like the holy grail. So at the time in May or so, I was trying to stress people. Like minimally, but having the
blood. Give me your blood.
You wouldn't believe the things I tried. No, so we were doing like cryo chamber, we were doing hyperbaric chamber, we were doing all these things that we saw an elevation. It was good enough. But the cool thing is, so Brian Johnson was in Stockholm. Had this event together with a friend of mine, Ash. Called the Superhuman. So Ash basically told me, Tobbe, you always have some cool stuff that you're doing. You want to have a corner. So I went there with my devices and my nurse, and we drew blood. So we're basically telling these biohackers and longevity people that, hey, you want to have your stem cell count? Come here. Everybody wanted their stem cell concentration. They had no idea why. But then again, I can tell you, it's just like you said, if you're healthy, if you're good, you should have a rather low or medium amount of stem cells, especially the stress-induced ones.
How would that appear on the blood work?
So it's not a simple test. I have to do centrifuge and then another spin, and I have to transfer the plasma. So it's a bit of a thing. But then when I put it in the device, the cell counter, then I can see exactly the size of the cells and the amount.
Okay.
So basically, you shouldn't have a lot of the V cells, the smallest ones, active when you're healthy. So basically what happened is that everybody filled in the form. They're, part of the study, and, normal health form. So if I found out that, oh shit, this guy had like many more cells, this is not supposed to be like it. So I just sent them like, you had a very high amount. What did you do the last week? So some of them were like, yeah, I did this and that. And because they were doing a lot of funny treatment, these longevity guys. Yeah. So it made sense. But in some cases, actually, I think 4 or 5 of them, we actually found like diseases or something like that. So we're telling them like, if you don't know why, you should probably have some tests done because this was very high. Something like
so your body's fighting something internally. Yeah. So it's preparing to fight.
So autoimmune diseases is one of these things that, chronic inflammation that is actually could elevate the amount of cells, which isn't good. So anyway, when the diet is finished, I was invited to this nice gala dinner. I couldn't go because I was analyzing tests. I had too many tests. Everybody wanted to, their stem cell count. So at the end of the night, I'm like, okay, screw this. I'm taking the devices home, put them in the fridge in the clinic, and analyze them in the morning. So I came back in the morning, and they had tripled overnight. So I realized that I could stress the blood after taking it out instead of stressing the person before taking it out. So that was a major finding. So basically, at this point now, we get something like 150 million cells from 6 tubes of blood, which is very easy amount to draw. And it's they're small enough to pass through an IV, and they're fantastic for the local one. So this, I believe, is a fantastic finding. So obviously, just the stem cell count will not tell you what type of cell they are, just the size and if they're alive. So I had to expose them to antibodies to actually prove that they were in fact pluripotent, and they were. I could, the antibodies that we use then are normal embryonic markers. So only embryonic cells are supposed to shine up in colors, and they did. Mm-hmm. So I took the pictures with a microscope, and I published the paper, and I was the first in the world.
Wow.
So it's cool. And since then, I've been traveling all over the world talking about my cells. Basically, now I'm here.
When was this?
This was this summer. So it's very recent.
Wow.
And the cool thing is then that in all the countries, we talked a little bit about the legislation. They're going to be legal everywhere because it's your own blood.
You can't forbid your own blood.
Exactly.
I mean, you do PRP to get your hair grown again. You might as well do stem cells now because
I would believe that the only thing they could forbid me actually saying that they're pluripotent stem cells. You could just call it a plasma fraction. Mm-hmm. Because it's a fraction of the plasma. That's it. So they will definitely be allowed in almost any country. The wording might be different.
Are those the V cells you meant?
So the ones that I found with this protocol, that we draw blood and then I spin it, put it in the fridge. So basically, I didn't say that. I had to find out obviously where the sweet spot was. So 16 hours overnight is a bit long. After 4.5 hours, they don't multiply anymore. So basically, that's the sweet spot. So you come in the morning, we draw blood, we put it in the fridge for 4.5 hours. You come back in the afternoon, you have 150 to 300 million cells, basically.
Yeah, that's what I did.
Yeah. Sorry, what did you ask?
No. Before moving on, just quick, just from summary perspective.
Yeah.
So the idea was you found a paper from Greek scientists that they basically stated you can get pluripotent stem cells out of your own blood. You realize that they overstated by 5-6 times that it's not 90 million, it's around 20 million. But because of the fact that you were able to stress them after drawing the blood through the system that you came up with, you were able to multiply up to 100, 150, which is above the gold standard of 100 million. So they're pluripotent, they're your own blood, so it's legal everywhere in the world.
Exactly.
And they're also small enough to fit through. So I could now actually do the IV if I want to do an IV.
Yeah, exactly.
With those stem cells.
So they're actually 2 types. That's what you were asking. So you had the V cells, but also the small blood stem cell, the ones that actually the Greeks were talking about. So since my protocol, the way I describe it now, you actually get the 2 cell types. I could name them something else. Mm-hmm. I call them something else. They're going to be called the Ogéus spark cells.
The Ogéus spark cells?
Yeah.
Nice.
So that's the next generation of stem cells.
Yeah. So this is the Spark platform is what we're going to use and then try to market it with. So it's going to be a good time ahead of us.
Is this something that somebody else could do, or is it?
Yeah.
Okay. So it's not like you're trying to gatekeep.
I mean, everybody could, because science is open. It's open science. Everybody can read it and everybody could copy it. But of course, what I would say is, well, I invented it.
You're the first one who published it.
I'm the first one, yeah. And we've been doing it since, I guess, June.
Yeah.
So we've definitely done most. I think there's just one other guy that copied my method.
So there's people out there who are basically re-saying the same words without mentioned in the beginning that Toby invented it, published it, did the human trial and all those things.
Which is fine. It's I'm flattered by it.
That's first. Now comes the second part. So when Mike and I see, hey, come to our clinic and do the stem cell treatment, there's two aspects there. If I have pain and I don't know a solution, stem cells might be a solution. But then there's other people, the longevity, the biohackers, who don't have an acute problem.
Yeah.
Is this still relevant? Can stem cells be relevant for people like this?
Sure. Stem cells could be. Exosomes, which I mentioned in passing, basically the signaling particles, messengers from stem cells, they're even more interesting. So in most concentration of stem cells, you will always have some exosomes in the fluid, because as soon as the stem cells are activated, they will shoot out the exosomes. So exosomes are even smaller. They're nanoparticles. So there's a major distinction here that needs to be done. If we're talking about stuff in the blood, in the system, in the body, the small cells, they will probably reach there. They will not be able to travel into the brain because you have something called the blood-brain barrier. So, the filter, let's call it that, is like nanometer, supposed to be like one. I think the largest ones are like 100 nanometers or 150 nanometers that can pass through. So micrometer is like 1,000 nanometers. So no cell is going to pass into the brain. So if someone is claiming like, let's heal your autism with an IV or some kind of, I don't know, Parkinson or whatever, that's not going to happen. With the exosomes, they're actually small enough to travel through the blood-brain barrier. So exosome treatments are also very, very popular. We've been doing it for the last, I think, 3 years or so in Stockholm. Fantastic results. So for longevity, for someone who isn't actually, sick or have injuries, it's fantastic. So the first ones, I didn't on myself, obviously.
Of course.
That's how it works.
Hey, Dad, can I inject that too?
It was just like 15 years later or so.
6 months ago.
So what happened is, my knee is fine. My knee is still fine, actually.
He's like, now I'm going to fix my head.
I'll probably need even more, go in my head. No, my hip. I used to play, old boys football, and I got osteoarthritis in the hip. It's probably from my career as well. I trained way too much when I was younger. So I've been working with my hip for the last years. It's better, but it's not fantastic yet.
The one thing that, again, for the audience and also for Mike, because this topic is very, very, for me, was very difficult to fully unpack and understand. But Dr. Toby was very, very eloquent in saying stem cells are building blocks. Exosomes are construction workers. So if your body has a reaction to something, is under stress, or you inject stem cells, the exosomes are the construction worker, do something with the stem cells. So the more exosomes you have, the more they can construct, the more they can build.
Yeah.
So that comes then to the realization. My question to you is, does it even make sense to have a standalone stem cells only procedure without exosomes, or exosomes only without stem cells?
It's difficult to separate them, actually. Because as I said, in all the fluids that will have stem cells, we'll probably have some exosomes.
So when you inject 150 million stem cells, there will be also almost always exosomes in there too?
Yes. It's not going to be a high dose, but and then obviously when they circulate in the blood, they're going to shoot out the exosomes. So you can't really separate them, but you can definitely have a much higher dose of exosomes. So what we're using are trillions, actually 4 trillions in one dose, which is a high number. So when I did the first one on myself, I did it in the hip, half in the hip, half intravenously, because that's how I was told I was supposed to do it. I was not the first in the world. I was definitely first in Sweden. What happens is actually when you use exosomes like that is that you feel a little bit, I wouldn't say sick, but if you're registering like with the Oura Ring, your pulse goes up after a couple of days, and you sweat more. You have a little bit of aching in all the injuries, and since I injured my whole body playing handball, I had pain everywhere. Not very bad, but it wasn't nice. Yeah. And actually, like half a degree of temperature up, which resided after like a week, and then it was just like it was before. But then, after like a month, 5-6 weeks, I felt like 10 years younger. Like, I'm going to hit the gym. You know, this is going to be good fun. And that's a change. I mean, I'm 46, as I said, and I was, 43 at the time, I guess. Since 40, and with the career that I used to have, I mean, I dislocated my left shoulder 11 times, my right 3 times. I tore my biceps.
This is all from handball?
Yes.
Why does it sound so violent?
It is.
Handball's incredibly violent.
I mean, it's like you don't have any
protection
or anything. It's like rugby, but we're actually tall. No, I'm kidding. I mean, rugby is tough as well, but it's very physical. It's a very physical sport. And you know, I tore my infraspinatus. I broke every other rib. Yes. So when everything
so basically, you're saying the reason why you were down for a week or 2 was because your body was repairing inside, and because you had so much damage, it took so long, and it was so uncomfortable.
Yeah, exactly. But then, you know, I was saying from the age of 40, everything is like the expiration date passed. You know, everything hurt. Getting up in the morning like, I'm making sounds just by sitting and standing up from the couch, you know. But at that point, after a month with the exosomes, I was like, there's no morning pain. I'm not stiff. I can do this. So I did it in October or something, I think. And in the spring, after that, I
stopped playing handball again.
Well, actually, kind of.
Let me go back where the pain came from.
Pretty much. So what happened is that in the gym, I was hitting the same weights as when I was 27.
Wow.
You know, I was doing like 195 kilos in bench press. I was squatting 250. It was like I was, 30 again.
Yeah.
And then, yes, in May that year, I actually took part in the Swedish Championship for old boys. 5 games in 2 days. So that was horrible.
Nice.
But I mean, my hip was fine. I survived. I had pain in all of the body. But actually, 2 guys were injured because they ran into me.
Okay. That's a good sign.
Let's go back to, again, I'm just repetitive because it's from a news. So if it's stem cells, it's 100 million plus is the gold standard.
Yeah.
And you're talking about exosomes, you're talking about the trillions.
Yeah.
I see a lot of posts about exosomes talking about billions. Just to make clear for the audience, when somebody injects billions of exosomes in you, the impact of that would be?
Very little. At best, if it's only used locally, let's say for the skin or the hair or inside of an elbow or something, it could be enough.
Now let's speak about that. So the funny part is every time Dr. Torbjörn actually treats pain, people who can't barely stand or walk. But 99% of the questions he gets is, what can I do with my face or with my hair?
Yeah.
So now comes my question is, if I do the math correctly, so if my body experiences stress, it will send stem cells there. If I then use exosomes externally, I can impact that. So, for example, if I take my face and I make my face cold, would that my body then send stem cells there? And if I then inject exosomes into my face, would that create an additional benefit? Or do I have to create inflammation in that area for then my body to react to it?
That is a good, let's do a study on that. I'm performing some small studies on testing that exactly with the cryotherapy. And I don't believe you need to do it to get the effects. Because
your body has enough stem cells for your face and for your hair because it's not that big of an organ?
I mean, if you take them, let's say from the blood and concentrate them, then you're going to have more than enough. You don't need the cryo.
Okay.
That's what I'm thinking.
What do they want from the face? They want to look younger. Or what and the hair, they want to either...
Well, you don't want to look like me.
Yeah, well, we've all had hair transplants here. So.
Well, he's next. So the idea, from my understanding, is if my exosome count, does it diminish with time or is it always the same?
No, I mean, your exosome count is going to be, that's depending on the amount of stem cells activated. So everything heals with stem cells.
Yes.
In all of the tissues, you have a stem cell that is typical for that tissue. So in the muscle, you have a muscle stem cell. In the bone, you have a bone stem cell and so on.
So, okay, but most people, it's very simple. Again, I'm sorry for being so vain, but most people, I would like my face to look like when I was 25.
Yeah.
You're coming saying, hey, actually, for your face, you don't need to inject stem cells. You can just inject exosomes. That should be enough. So what do the exosomes do? It's the protein synthesis?
So the exosomes are basically gas pedal to all healing. So what we experienced when we started using them, because we were using them mostly for knees and hips and shoulders, which is what I work with, but we also did the IV. Half of the dosage IV, half in the knee, for instance. People came back and they were like, yeah, my knee is good, but my neck is better. Or my IBS that I used to have problem with is gone. Or gluten intolerance is better. Stuff like that. Very, very broad. We were, shooting at things and we had other effects, like positive side effects, which is fantastic. And skin getting better. I will tell you, I used to have the ugliest feet. So, I'm a guy, athlete's foot, what it's called. So, with the cracks and the skin is, I'm a big guy as well, so big feet.
Yeah.
I think it was last year or year before that, my girlfriend was telling me like, Tobbe, your feet are like babies. They're fantastic. All the cracks are gone. I haven't done anything to the feet. It's just the exosomes. So you definitely have repair everywhere. Of course, it's difficult to steer it. If you want to have the effect in the face, then you would have to do injections in the face, actually. So, for wrinkles or stuff like that, it's super simple. I don't do it. I have nurses that will have to do it, but I deal with pain. But basically, if you imagine that you have a wrinkle that is basically, a fold in the skin. So if you go below that, just like a couple of millimeters below, and you actually shoot or inject like a pool of exosomes or platelets or stem cells for that matter, then you can use the microneedling, like a dermapen or something. So you're breaking up the fold, and they splash in the pool with all the growth hormone, growth factors or stuff like that. So that's the way I would do it.
So it's different to Botox, where Botox is basically just...
Botox is just basically a nerve toxin.
Nerves,
yeah. So basically your nerves are not going to work for 5 months.
Yeah.
That's Botox.
Yeah.
So you're just going to relax muscles and you're not going to be able to move them. Here we can actually have real healing to the skin. And for hair, it's fantastic. If they're gone, if it's like, you're bald, that's it, you're bald. But if you have like small pieces of hair left, you can actually get them to grow.
So it's getting it to grow back thicker, or
exactly that.
Okay.
So, I actually did just with platelets a couple of years ago to prove that my version of platelet was better than PRP. And I had a decent amount of hair that I got back. And I just, didn't feel like continuing injecting myself in the head. Yeah. So now I'm bald again.
Okay, so you would say it's better than the PRP?
It's simple. PRP is basically concentrating platelets 5 times more than normal blood. That's PRP per definition. So PRF that I'm using, you can concentrate the platelets 16 times more. So you have a lot more kick in every milliliter of,
so 3.3 times more than PRP.
Okay. And you do it one-off, that's it? Or is it?
No, for hair, for skin, you would definitely want to have like a series. And if it's for us guys, if you start losing the hair, you're going to keep losing it. So you have to keep injecting it.
Yeah.
So I was told once a month. You do this once a month in regards to support.
Yeah. You could do it probably like a series and then every 6 months or something like that, a couple of injections.
Okay.
Okay, before we go too much into our vanity here, when someone comes to your clinic and says, hey, I saw online this whole thing, stem cells, I want to do stem cells, what's the first thing you assess that person, if he is or she is the right person to receive stem cells?
Yeah, 90% of my patients have osteoarthritis or a tendon issue. So we usually want an X-ray or an MRI or an ultrasound scan. I do the ultrasound scans myself every day. If we can see, if we can see the injury, I can probably fix it or even try to fix it. If it's very, very long gone in osteoarthritis terms, it's probably better with a surgery. But if it's in like the beginning stage, it's fantastic. We can really fix that. If it's in the medium phase, we can get it better. So that's the first thing. We have some kind of imaging done. Then obviously I talk to them and I ask them if they have any other problems that we need to know of. Cancer is one of these things that nobody wants to treat. I actually believe that exosomes can help with cancer. But if I said that I'm treating cancer, I'd probably lose my license in every country. So that's we're not going there.
Mhm.
But I believe there is definitely research being done on exosomes and cancer, which looks very, very promising.
So the question is, and other people that should not be doing stem cell therapy?
I would say if you have an active cancer, you just had one, I would be careful, let's say. There are places that could do it and have the screening for it. I'm not one of them, sorry. But otherwise, it could be like you're on some kind of blood thinner medication that we need to look at, and some small things. But in general, most people can do it. It's not dangerous.
And age doesn't matter either.
No. Yeah, the cool thing is, I mean, most guys that come or women that come are probably around 45, 50. Because that's when you start having osteoarthritis and these things. We have a lot of seniors, 65 plus, even 85-year-olds. And the thing is, if you're 50 or 45, you want to get back to actually playing basketball or handball in my case, and that's more difficult to achieve. An 85-year-old probably just want to be able to walk with a dog for a kilometer or walk to the store again, and we can usually get that done. So it's, I mean, it doesn't really matter. And since these cells that I'm talking about are basically embryonic, they're just a reservoir the body stores, like a backup plan.
So if you're somebody like me, for example, I'm 35, pretty fit, pretty healthy, don't have any injuries that have caused me any issues, but I want to look my best and perform at my best, particularly in the gym, lift as heavy as I can and recover as quickly as I can, and just on a day-to-day basis have lots of energy. Would it help?
Exosomes would definitely help. The stem cells could not harm.
But it could find something that I'm not even aware of.
Exactly that. So what I'm usually saying is that there will be healing. We don't know exactly where. If we shoot it intravenously, it's going to be somewhere. But there will definitely be healing. And sometimes it's the things that you don't really feel or see that could really help you, let's say. But obviously, if we have something like we found a tendon in your shoulder, it's much easier to actually have a prognosis. Then I can tell you in 100 days it's going to be like this. Then we take a new picture and we see the healing,
But when you say exosomes, so stem cells you can derive from your own blood. Exosomes you can also derive from your own blood, but you will not get trillions.
This, I will answer you an exact amount because I bought a new device. I'm going to do the studies, the days after Christmas, I guess, when I'm back in Sweden. I believe I can definitely get the trillions. The question is just how much blood do I need to draw and how long do I have to process it?
But until you find that, as of today, if I would like to get trillions right now, I would buy them or receive them. It will be not my own blood.
So the ones we have been using and the ones I've published about are from amniotic fluid. So basically, in the amniotic fluid, you have a lot of stem cells swimming around, building the baby in the mother's womb, basically. So it's fully grown, full-gone pregnancies, C-sections that are planned. So instead of just throwing away the fluid, we use it. Well, I wouldn't say that I use it. It's a lab in Miami that does it for me. So they extract the stem cells and the exosomes. So then you can get the trillions because the fluid is, there's a lot of fluid, a lot of stem cells, a lot of exosomes. And then you can actually get exosomes from the umbilical cord fluid as well. There are different sources. Since there are no cells, no DNA, in many countries they're allowed, as donated cells are not allowed in all countries.
As a customer, how can you be sure that you're getting exactly the amount of stem cells that you told you've been getting?
Yeah, well, I mean, the stem cells that we get, I can actually, I test every, I wouldn't say batch, but every time I treat someone, I will give them their numbers because I just take a drop and analyze it and you will have the concentration.
Okay.
So I will tell you, like, you had 158 million.
Okay.
I'm going to tell you some funny anecdote. So we've been doing this since May. I think we've done 150 treatments. So the highest number was extremely high, 537 or something like that, which is way more than 150, which is the medium, the middle.
So 537 million stem cells you found in
one from 6 tubes of blood from one person. So I'm asking this woman, what did you do? This is, what she answered me? It hurts my scientific heart. She did healing therapy. So,
like spiritual.
yes.
Yeah.
So I asked her, okay, tell me more. You know?
Like
So there was some healing going on with the hands, and I don't know.
Wow.
Yes. It could, of course, be a coincidence. It's just one person, one time. I'm actually going to ask that person to come back and do the healing again so I can measure once more.
So basically, if you just ran a marathon, you had 150 million. And then if you have a healing procedure, like 500. So there must be a lot of things wrong there.
Yes. Or, I mean, if I'm trying to explain it scientifically, it would be like placebo. Placebo is not bad. It's the body's own healing mechanisms. And she really believed in this healing. So probably that could be it, you know? If I'm trying to explain it.
What was she trying to heal?
Yeah.
Like, what was it?
She went to the healer while she was doing the treatment in my clinic. So probably to push it, or I don't know.
Okay.
She thought it was a good combination.
But so basically, this is a way to actually prove that this kind of healing works.
It could. I mean, once is not proof.
Yeah.
It's just an anecdote. It's a funny anecdote.
That's a great anecdote.
Yeah.
I thought you were going to say she went through a divorce or something.
Yeah. I mean, that would have been, more logical. Would have made more sense to me.
From
but
a stress factor.
It's fun.
So Exosomes perspective. So we get them, you would get them from, again, sources, Miami, C-section, water, because that, but you believe that in the nearest future, you'll be able also to extract it from your own blood?
Yes, from the new stem cells that I talked about earlier.
Yeah.
So we're going to have the spark exosomes.
Spark exosomes. So you have the spark stem cells and spark exosomes?
Yeah.
Is that like, would you say that's the next generation? So right now, if you go online, Muse stem cells is considered, I don't know if it's the best, but it's considered one of the better solutions.
Sure. And
the spark is basically Muse stem cells, the next level, because it's from your own blood?
Yes. So, I mean, Muse is fantastic. They're still too big. You still have the problem with the IV. They're going to be stuck in the lungs.
So if I do an IV with Muse stem cells, it's basically, again, stuck in the lung. It's not really working.
Yeah.
Do you know like 90% of the clinics right now after this episode will have to...
You can put them all out of business.
Yes. They will have to... I mean, that's where the money is.
Yes, I know.
That's where the money is.
Yeah.
The stem cells IVs.
I mean, the Muse cells are very similar to the ones I'm talking about. They're pluripotent. They're just a bit bigger, So they're fantastic if you inject them in the knee or in a tendon or something like that. But IV, no.
I think the important part is also here, if you combine a couple of things. One thing is the blood circulation is every 12 seconds, your blood goes completely through your body, 12 to 15 seconds, right? But if they would go through your body, they would get stuck in your lungs. So what you do is you localize them by creating inflammation in a certain area. So when you then inject stem cells and exosomes, the blood or stem cells will stay in that area to fight that inflammation. Can you explain that a little bit? Because it's basically you're causing damage or pain to your own benefit. Can you explain that?
Yeah, sure. I mean, basically a big part of the healing process, the ones that we can start with the platelets I told you about, is doing just that. It causes inflammation. So inflammation is great when it's in the right place, in the right time. So it basically speeds on the cell dividing. So we'll have more of the building material. So you definitely need this. So if you use something that increases the inflammation and then at the same time or straight after stem cells or exosomes or something, it's definitely going to be beneficial for sure.
So when you're talking about, so I came for 3 days. And we did the stem cells, we did the exosomes, and we did the inflammation into my knees.
Yeah.
Can you explain most of the people here have problems with the knees or any symptoms of joints. So what can you expect? Why is it 3 days? Why does it take 3 days?
It could actually be 5 days as well.
Okay.
Depends on I guess the injury, how big it is. So if it's osteoarthritis that is like a bit worse, we definitely do 3 injections over a week. So Monday, Wednesday, Friday or something like that. And the protocol that we're using a lot now, we have different for different, stages, I guess. So the smallest one, the cheapest one would be if you just use platelets, obviously. That's not going to be enough for a lot of people.
Now we're talking about 40 plus, runs a lot, that goes to the gym a lot, feels his knees.
Yeah.
But doesn't stop being active.
Yeah.
I think that's the audience we're speaking to.
So a lot of these guys could have platelets and exosomes together, combined, once or twice. fantastic results. If it's not very bad. If it is worse, then you want to add the exosomes and the stem cells with the exosomes. And if it's really bad, you probably want to have a hydrogel as well, which is a scaffold for the cells. So the problem with stem cells is usually that they swim around basically in the knee before finding the spot that they're supposed to attach and then heal. If you use a hydrogel, it's a synthetic gel that is seen from the body as biologic. So it basically integrates into the cartilage, into the bone and the joint, basically the joint space. So if you inject stem cells together with that, they integrate together. So you'll have a much faster integration and a more solid anchorage, let's say. So those are the things. And then the last thing that we're using is cytokines. So cytokines are basically the signaling messengers from platelets. So you have cytokines that increase inflammation, we talked about, and then you have cytokines that decrease inflammation. So if we're doing a treatment with stem cells, we usually use stem cells and exosomes, then stem cells and the hydrogel, and then stem cells and the cytokines to lower the inflammation in the last treatment that we do to get out on the other side. Then, we had enough of the inflammation for the first 5-6 days, and then we want to lower it. So that's, we have different protocols for different problems, let's say. And it could be, it's definitely not going to be the same price as some of the other clinics out there. So I think I went to the podcast with Tim Gray in London. He said something like I was democratizing stem cells, and I like that actually.
Absolutely. I mean, from a pricing perspective, we're talking about 2-3 times more affordable.
Yeah.
While having the highest quality, and not having to fly to Panama, Honduras, or Mexico.
Yeah, and clog your lungs. Sure.
If somebody's having lots of different treatments for an injury or whatever it might be, how can you tell what was the exact thing which helped to fix the issue? Like, how do you know that, it was the stem cells that helped?
Yeah. So, I mean, I haven't really talked about it today, but I published a lot of studies. So like 12, 13 in the last 2 years. I have 10 years of clinical data that I'm publishing basically. So the protocols that I'm using now, it just sounds like I'm spitting out. It's actually, we really, tried them out and added things as we went. And then we saw the additional effect. So now we have a very good way of meeting. I mean, I will look at your pictures of whatever, your knee or your hip. And then I can really tell you that I believe we should go with this one. A lot of people just want to have the most expensive, and I will many times tell them like, no, that's not necessarily better. Just do what you need. The downtime is less, and so we really try to meet every person's issues. So we have a lot of data, we have a lot of experience, and everything is published.
What's the most impressive recovery you've seen?
I mean, I've seen some knees that are amazing. Pictures that are like, you can hardly even see the cartilage, and then it's like full thick, like a 24-year-old. It's some of them are fantastic. Some X-rays that before and after pics, you don't even believe is true.
Yeah.
But I have hundreds of them, so I start to believe it.
When I was fortunate, when you were on the stage in London, he was talking about that at that given moment, because it's very, very, very new. He had like 54 patients going through this program, and like 3 or 4 of them were in the crowd, and they would get up and share their stories, like literally in tears. Like they couldn't walk, they couldn't move, they couldn't breathe. And after that experience, so just if you share some of the cases, I think for the audience, okay, if you have bad knees, stem cells is good.
Yeah.
Joints, pain, stem cells is good. Cartilage, stem cells is good. But what other areas that have you seen where that can be beneficial? So people understand, hey, this might be something for me.
Yeah. I mean, the cool thing is what I mentioned a little bit earlier, like IBS, which is not necessarily something you would normally get stem cells for. The exosome seems to fix that. It's difficult for me to promise. I will probably not sell a treatment for IBS, but for general healing, let's say, a lot of really cool things.
So that would be one of the ways where you can get an IV, where it's general health with including potentially improving your gut and your digestion function.
Exactly that. Cognitive function, 100%. I mean, almost everyone that gets exosomes IV will tell me like, I feel much more brighter in my head. I feel like I'm sleeping better. I have better quality. And so that is actually really cool, really fantastic. So that
we
almost
discussed this
everyone
with
can
you,
do.
where you're like, when you talk about different, therapies or what's out there, you were always looking for which ones can get me more focused, which can give me like more that stimul, where people are like, hey, I'm on more. So exosomes might be one of those
For sure.
beneficial and very natural ones.
Yeah, exactly that.
And then the last thing that Mike was like, I'm not getting sick. I have no pain. I was never injured. I'm great. Do I still need stem cells? Well, or exosomes? I wrote to you a couple months ago. There was this guy who was promising if you inject exosomes in your genitals. Maybe Mike, that might be a topic. Could you please explain more on that? What's there?
Well, I mean, there is a protocol.
I'm not making this up.
No.
Don't tell me you tried it on yourself.
Hey, Dad. I've been doing it for 6 months. Nothing happened.
Let's have this discussion when we turn the microphones off. But if, say, someone were to...
What the hell were you spinning the whole time?
The thing is, it's actually very simple. If we try to keep it like
PG-13?
logical.
Okay, cool.
So theoretically, if you're using a vacuum pump, you could really push like the boundaries of how big an erection is.
Okay.
Like you're pushing it, because it's pulling with the vacuum. So you can create small micro tears, right? Small tears to the the
understood
bodies of the actual glands.
It's like the guys who break their legs and then the cartilage grows in between together. Okay.
So if you then inject stuff while you're doing this protocol, like stretching it, let's say, you could definitely get an increase, both in size, like girth-wise, and actually centimeters. So that is being done, not by me, not in my clinic, but it's I think they called it a P shot. So it's definitely being done in the world, and I'm quite sure there is a market for it. It's just not. I'm not going to do it.
I mean, you refuse to do face and hair, so it's a long way to P shot.
But it is definitely possible.
Why is it that you refuse to do the face and hair?
I mean, it's like this. In Sweden, I'm not allowed.
Okay.
It has to be like an aesthetic nurse or a special doctor to do it.
Okay.
And I'm not really interested.
Yeah.
But I create the protocols. I will definitely have people working with me that will do it. And it's fantastic. But
well, I guess it's one of those things. If you're trying to do too much and focus on too many things, then
100%.
Yeah.
So I mean, what I'm really good at, if I'm saying it like that, is I can inject knees and hips and shoulders, fingers, toes, thumbs. I worked like the last 10 years learning how to do that like perfectly. Together with another specialist in my team, we also do spine and neck, which is more difficult. We have some fantastic results of nerves actually. But you shouldn't really, I mean, you can't be like specialized in everything. You lose credibility and you can't be best at everything. It's better to be really good at what you do, I guess.
Yeah.
On the exosome, when you say about research, was that research done on humans?
Yeah, so I published, I think, 3 papers as of now. Well, maybe in 4. So last year or this summer, I had the first 2-year follow-up on 608 patients for all kinds of conditions. So basically showing that they were safe and that you have these broad effects on a lot of things. So that was the biggest one. Then I have some on osteoarthritis, obviously, on knees and hips. And nobody ever published those kind of papers before.
So you're the first one who published on human and exosomes on humans that they're safe and effective?
Yeah.
Okay.
In like real life clinical data.
How many people are there like you doing these?
I mean, there are a lot of clinics that actually do treatments. There are not a lot of clinics publishing. So this, I mean, to me, that's an issue because it's like we're really on the front line. We're doing like really cool stuff, but it's not very. There's not a lot of research. So if you're not conducting research at the clinic while you're doing stuff like that, it's I wouldn't really trust them. Because it's really new and it's even if it's safe, it's biologic. The worst thing that happens is that, you just throw away your money. It's still, if you're not publishing data, that means that you probably don't have data.
Yeah.
Why aren't you storing data?
And you never know if what you inject, worst case, and if what you inject works in any sense. I think I remember the first time when we started that, you're like, we need a before picture. I'm like, before picture, can we do an after picture? Because I want to see and show the results of it. Yeah. And also including the amount of stem cells actually used. Yeah. And I think this is a critical thing. There's so much hype right now, so that you just come in like, I want stem cells, and you get an IV of stem cells that get stuck here. You don't know how many there were. Was it actually stem cells? Was there any benefit to it? Yeah. So I think what you're doing is really, really great in terms of just from a research perspective and an evidence-based perspective. Yeah. And it cleans up the field, as we said in the beginning.
I'm surprised there's not more people doing what you're doing, because the data
because
is
it
there.
sells by itself. If it's something sells by itself, why would they take part of what they're making and putting in research? When
it is a pain in the ass to write science. Yeah, it's difficult if you don't know how. The first 2 papers that I published took me like 3-4 years to get out there. Now I'm into it. Now it's faster. and I set the system from the beginning that I actually collect the data in my medical file system, so I can just extract it, which is, a lot of people don't think about that. They just want to earn money and hopefully help people. But then again, if you don't save data, how do you know if you really help them? So
I'm trying to imagine, for example, all these doctors that are doing these surgeries, do they ever use stem cells to help with the procedure, or are they like kind of in their lane and they want to stay away from it?
In Sweden, it's like that.
Yeah.
In other countries, I mean, I have doctors that I work together with, like internationally, and in some countries it's fantastic. So I would love to work with an orthopedic surgeon together to actually combine sometimes that would be the best. So what we've done many times is that they have the surgeon, then shortly thereafter, I will inject exosomes or stem cells, for that matter, to speed the healing process.
Because that would sound like the perfect combination.
Yeah, we actually did that. I mean, I can talk about it because it's been official. Otherwise, talking about patients is strictly not okay. But we have a boxer that he actually turned world champion last year. No, it was this year in May. Anyway, so he tore his bicep, his left bicep, in the second round when he was fighting for the Intercontinental belt. He finished that match with just one arm, faking, like, he found a way to feint, and he won on points. So he came to me like 2 days later, like, Torbjörn, what do we do? So then obviously it needs to be reattached by a surgeon. So we had the surgeon, the operation done, and then shortly thereafter we injected exosomes and I think stem cells as well. And he got back in like record time. Then like 4 months later, he became the world champion. So that is actually fantastic. So that I mean, the speed of that recovery is just amazing. Yeah. So we can definitely do stuff like that. But it's still kind of new. So the orthopedic surgeons, I mean, they're fantastic at what they do, obviously, but in their school there are no courses on regenerative medicine. So this is something you have to. It's another track. It's another specialty. Yeah. So
before we kind of get to the end, and it's been incredibly insightful and very, very interesting. There's another thing besides stem cells and exosomes from a methodology perspective that people are doing. It is this blood plasma transfer cleaning, apheresis is the term.
Apheresis, yes.
Apheresis that's popping up more and more. I hear ozone, I hear EBU, I hear apheresis. Yeah. What is it? Should I care? Should I do? Why should I do it?
Good question. It's I mean, it's fantastically interesting. I just thought that, or still think actually, that 90% of people doing it are doing shit. They don't know what they're doing. They're not specialized, and they can actually harm the patient.
So we're talking about doing, so just for everybody here.
Just taking the metals out of the blood.
That is an idea that you could do. Yeah. So basically, it's like a dialysis. So you connect it to 2 tubes, basically, and there are filters.
It's cleaning your blood.
Yeah, I see people after with pictures of this bag.
Exactly.
Right?
And they're like, look how much quote unquote dirt I took out, and then now the doctor will tell you.
Yeah. So, I mean, there is one treatment that you will actually have a bag of plasma outside of the body. It's called the apheresis. And I have to say, this is not my specialty, so I might actually say something that is not 100% correct. But basically, if you're doing a normal plasmapheresis, a normal apheresis, you should have filters that are full of shit, but you should still have your plasma. So you shouldn't have a big bag of plasma that is full of stuff, because
you need the plasma.
I mean, the plasma is good for you.
Yeah.
And the thing is, there are definitely different ways of doing it. And I just opened this door recently because I met a guy in London, actually, when we were there. He is basically the best in the world at apheresis. So we realized quite quickly that we have to work together because, combining the two treatments with exosomes and stem cells and apheresis could be fantastic.
So apheresis, again, it's a filtering out the toxins out of your blood.
Yeah, toxins for sure. Microplastics, heavy metals, spike protein is a bit controversial to say, but I think they can actually do that as well with the right apheresis device. So imagine it like this: the tissues will definitely have toxins. They have stuff. They have things that is dumped in the blood. Let's say you clean the blood, then the tissue is going to dump it even more, and then you clean it again and again. So eventually, you will actually have clean blood and tissues.
Mm-hmm.
So just doing once, sure. If we drink a lot of alcohol, we could probably get rid of the hangover by doing the health apheresis or something like that. But it's, a series of treatments probably, what should be done. So what we found out is obviously if we combine the two treatments, my finding with the new stem cells and a good version of apheresis, it could be very interesting because you're cleaning out a lot of the stuff that you don't want to have in the blood, let's say. Then directly after you start the healing process.
Mm-hmm.
So I'm restricted to the amount of tubes I can fit in a centrifuge when I'm doing the process. And it's from the plasma that we find the cells.
You do 6 tubes, for example.
Yeah, exactly. Because my centrifuge takes 6 tubes. Simple as that. But if all of the plasma is outside of the body at some point, then we can take all the stem cells from all the plasma. So we calculated that the number is something like 20 billion cells that you could actually activate. We're not going to inject.
Is that also the idea where you get the exosomes from? Because now you have enough.
Could be. That's going to be a bit more expensive than I would like to. But it could be. I'm going to do some serious testing, as I said, in about 2 weeks' time. So let's have a recap in a couple of months, and I will tell you exactly what we needed to do. But that could be definitely one way. So if we're combining the two treatments, we're going to call it stemapheresis. So the apheresis and stem cells at the same time.
The apheresis is the filtering, the cleaning, and then stem cell injection.
Yes. So you're sitting there in the machine for a couple of hours and you're cleaning yourself and then you get stem cells back. That is going to be a big one. So that is definitely something you could do, for longevity. If you're just... we
all have microplastics inside of us. We all have toxins inside of us.
Exactly. We're living here. It's not healthy for us for sure.
Mm-hmm.
So that is definitely, that's going to be big. So these two things that just happened in the last couple of months, actually the last year is, I think it's going to change a lot of things in the market.
Mm-hmm. So based on your, let's call it not speciality, ozone or any result that ends with you holding a bag is probably not most beneficial to your body.
Yeah.
And then what we should focus on apheresis in terms of toxin cleaning and filtering, that is beneficial to you?
Yeah.
Because you keep the plasma inside of you.
Yes and no. I would say, for us, if we're healthy, we just want to have a little boost and healing done, then I would definitely say that doing the heavier ones, like the apheresis, which is heavier, is probably not necessary.
Mm-hmm.
Then again, I'm going to talk with a guy. Maybe he will correct me.
Mm-hmm.
But the heavier you do it, you will also remove some parts of the plasma and the blood that you actually want there. So you take away the good stuff as well. And I would believe if you're healthy, you shouldn't do that. If you have a chronic disease, if you have long COVID, if you have stuff like that, yeah, sure, you need to clean everything out. So it's different,
Okay, fine. So if it's biohacking and longevity, it might not be necessary. But if there's a long form of COVID or something more chronic, that might be the way to go.
Yeah.
Which makes total sense.
What if you were seeing some negative side effects from a vaccine you took? Could you clean that out of your system?
I would say yes, that's what they're doing.
Mm-hmm.
There's a clinic in Cyprus that are very good at that. They have received a lot of threats and a lot of, this is not something you should talk about.
Yeah.
I know a doctor in London, I think he lost his license, but he got it back or something. It's very, very controversial.
Yeah.
So I would say the spike protein is something that is not really helping us.
Mm-hmm.
Sad to say. And as I said, it's very controversial. Now it's been a couple of years and nobody wants to really talk about, the bad effects and all that. But if you think about it, the way I see it, I took the 3 shots or something like that. Everybody had to. I wanted to travel and I worked with patients, so they forced me basically. I wasn't really afraid for myself, but I believed in it. Most guys did, I guess. So the main objectives, stopping the spread, it didn't stop the spread. Did it stop the disease? No, it didn't stop the disease. So the main things with the vaccine, it didn't do. So eventually the virus mutated and then it got weaker and we said, the pandemic is over. I'm not 100% sure it was the vaccines, but we injected billions of people with it. And of course you're going to have side effects. You have side effects with everything. So if you're injecting billions, of course there's going to be a percentage that are going to have problems, but this is not necessarily something that any would want to touch because it's very, very controversial, very delicate.
Yeah.
I understand it. I have my mentor basically. His best friend works in Wuhan, so he showed me pictures that he sent 10,000 body bags basically the first week. So COVID was horrible from the start, but it mutated very quickly. So when it reached Europe and reached us, it wasn't as strong. And the vaccine was always one step behind.
Mm-hmm.
So the virus mutated and the vaccine was one step behind. So we never got it. It just diluted itself out.
Yeah.
That's my take on it.
Okay, I would stop here talking about the past and being a step behind. Let's talk about the future. So last question. When you look at where regenerative medicine is heading, what gets you most excited?
What I really want to do, like egoistically, is probably like really heal osteoarthritis, like really fix it once and for all. I'm not really there yet. We're having great results. We get people better. Some get good enough. But if you come and you have no cartilage left whatsoever, I can't really help you. I'm sorry. I would like that. So that would, but I think exciting is more like, I think the positive side effect. I had a patient, I think it just texted me now actually, before I got here. British guy came to fix his foot, and he has lupus. So it's a chronic disease. And he always had levels, that there were markers that were testing. They were always in the wrong, level. So after exosomes, the first time in his life, the 2 markers were in the normal zone, like for like a normal person without lupus. So if we could actually, like, let's say, heal some of the really bad diseases, let's say dementia or Alzheimer's, stuff like that, it is possible for sure. That could be really cool.
Incredible. Yeah.
So that would be something to dream about. Let's heal osteoarthritis and Alzheimer's and Parkinson and ALS. Let's dream about that.
Which is the thing, you've got to kind of prioritize one over the other. Like, you need to decide what shall I focus on.
Yeah, well, I had osteoarthritis myself.
Yeah.
So I got like involved in that because of my own history. And I believe that's what it has to be. If you're supposed to like push the science forward, you need to have motivation.
Yeah.
So either it has to be yourself or someone close to you. Yeah. So, yeah.
Well, you're doing a good job.
Thank you.
Yeah.
Dr. Torbjörn Ögéus, where can people find you?
Well, in Stockholm, obviously, hopefully soon here in Dubai as well. So the easiest way as of now is probably the webpage, sls.nu. And my team will take care of
your personal social media account.
Yeah, my personal social media, SLSNU. Or you search for Dr. Torbjörn.
So, a funny story. He goes on stage in London for like an hour. He goes on stage, has, tens of thousands, comes back, has 50,000 followers more. He goes on stage. He went on stage and talked about, guys, I just found how I can make stem cells accessible to everyone in all countries, regardless of legislation, and it's safe. And people are just spreading. It's just spreading. It was the biggest breakthrough in the sector today.
Mm-hmm.
And they were starting there. And again, I think where everybody right now is talking about longevity, talking about preventiveness, talking about those things. But what you're saying is actually the cure to all might be inside of us already.
Exactly. In our bloodstream. Yeah. It's really cool. So simple.
Dr. Toby, thanks so much for your time.
Thank you. It was lovely being here.